I was honored when UBC asked me to speak at today's event because I feel my journey thus far represents an example of what the Centre for Excellence in Indigenous Health is striving to achieve. I'm a Canadian of Aboriginal descent who, with some encouragement and assistance, is well on my way to becoming a health professional. When I received that assistance, just about 5 years ago, I was a first-year university student with a vague idea of becoming a doctor, but I had a lot of self-doubt for numerous reasons. Growing up as a member of the Weebekam Band of the Kwakwaka'wakw First Nation in Campbell River, I didn't see members of my community working as health professionals, with the notable exception of a dental hygienist. I also wasn't a very diligent student. I didn't know very many people who went to university. The idea felt unattainable at best, so school felt like just a hoop to jump through, and my grades reflected that attitude. I actually dropped out of high school at the age of 16 when I was faced with an unplanned pregnancy. I could have let that set the boundaries for the rest of my life. But during my visits to my doctor throughout my pregnancy, I realized how much help he was providing to me, how fortunate I was to be receiving such support, and how much need there is for more people like him. And I wondered if I could help fill that need. It was a crossroads for me, and I made the decision to go down another path than the one I had been on. Instead of never returning to my studies, which is what so many people expected of me, I re-enrolled and I started to focus on my education for the first time in my life. I not only graduated, but I was admitted to the University of Victoria, where, against the advice of my high school counselor, I majored in science. It was during my first year at UVic that I attended a pre-admission workshop organized by UBC for students who were considering medical school. After attending the workshop, I realized that becoming a doctor was a real possibility, and I'm looking at James Andrew, who is behind all of it. Those workshops and the continuing assistance I received during the application process were crucial in counteracting all of the doubts and discouraging messages I've been receiving up until that point in my life. Now that I'm a medical student at UBC, I am helping to allay the doubts and discouragement of other Aboriginal students by attending these workshops as an advisor, helping them see that their futures do not have to be defined by their past nor their present. So I'm gratified to hear that some of the financial support that we're talking about today is going to such workshops and mentoring. I'm also gratified to hear that some of it is going to student financial aid. I myself have been supported by 3 separate scholarships, without which I would not have made it as far as I have today. I still have quite a long way to go, 2 more years of medical school, then 2+ years of residency, depending on what area of medicine I choose to specialize in. But I know this for sure. When I have completed my training, I intend to fulfill my original motivation for going down this path. One way or another, I will help Indigenous people get the care they need and the care they deserve. I have seen that need firsthand. I have seen members of my community failed by our medical system as they try to overcome addiction, and then I've seen them succeed thanks to a program run by the Namgis First Nation in Alert Bay that is more attuned to our culture. I have seen members of my community avoid going to the doctor because I have been alienated by judgmental health providers who have lectured them about their lifestyle instead of providing sympathetic, holistic care. Those are just 2 examples of why we need more health professionals who are of Aboriginal ancestry. We have an inherent understanding of the challenges faced by our members of our community. Those challenges may take many forms: mental health issues, financial issues. In many cases, they are the behaviors of the legacy of negative experiences as notorious as forced attendance in a residential school, or as private as a humiliating lecture from a doctor. We also understand our community strengths: the spirit of cooperation, the respect for tradition, the conviction that health is matter not just of body, but of spirit. Aboriginal health providers, having been raised in that environment, are ideally positioned to leverage our community's finest attributes in the course of providing treatment and preventing illness. We can collaborate with other health providers interested in Indigenous health to help fine-tune cultural humility skills as we work together to improve disparities. I mentioned earlier that I didn't see any Aboriginal health professionals growing up, except for the dental hygienist, but she was an exceptional role model because she wasn't content to just do her job. she also made a difference. She convinced her clinic to alter its payment policy so that patients wouldn't have to pay out of pocket for services and then seek reimbursement themselves, which was a significant disincentive to those seeking dental care. As a result of her efforts, the clinic provided services to members of my community without requiring payment up front, and the clinic dealt with the reimbursement process. It was a small step, but it made a large difference in helping to break down barriers to care. We need many more of these small steps because it will add up to a huge leap for Indigenous health. The gifts that we've announced today will enable those many small steps and that huge leap. So I would like to personally express my gratitude to Lindsay and Elizabeth Gordon, and to Rudy, Patricia, Caroline, and Rory North for having the vision to support the Centre for Excellence in Indigenous Health. Yes, it will have a direct benefit for people like me, Aboriginal students who want to become doctors, nurses, dentists, pharmacists, or other health professionals, but more important, it will benefit the communities from which we come, communities to which we owe so much. Thank you. Gaelic Asla.
Well, if Ellie is at all a representative of the future of our healthcare profession in the hands of Indigenous professionals, then I think we can all be rest assured we're heading in the right direction and we're safe.